Hello, and welcome to the Science on 7th live stream where we talk about topics related to air quality and health. I'm your host, Pallavi Pant. Air pollution is a problem around the world, and as a result, there are a variety of ways in which people are tackling the problem, both from generating data, understanding which solutions work, to implementing those solutions and designing policies. And one of the ways that we keep informed about how these developments are happening, where they're happening, what we're learning from them is through meeting places and conferences and events. And we have one such very interesting event coming up next week called the Clean Air Forum, which is an annual convening for the communities of practice in Africa, trying to create a space for knowledge exchange, collaborations, and partnerships to tackle the problem of air pollution in African continent. This will be the third year for the forum, and we are very excited to be a convening partner together with AirCo, which has been serving as the host for this conference and the forum, as well as many other organizations that have contributed in a variety of ways. We are expecting over 250 people at this conference, at this forum in Nairobi next week. And we thought it only fitting to spend today's live stream talking about air pollution in Africa. And I have a couple of fantastic guests to tell us more about both the problem, the new science that is happening, and the ways in which governments are tackling the issue. So first, I would like to welcome Dr. Evelyne Touré, who is a researcher, works on issues related to atmospheric science, air pollution, climate, and health. She works at the University Félix Houphouët-Boigny, I hope I got that almost right, in Côte d'Ivoire. She has partnered with a range of people across the world on trying to create and generate better data. And she also serves on the advisory panel for the Climate and Clean Air Coalition. So welcome, Evelyne. Very happy to have you here today. I would also like to welcome Dr. Tunde Ajayi, who is the General Manager of the Lagos State Environmental Protection Agency, or LASEPA. He's a trained physician, a public health specialist, and has a business degree. And he's worked on a whole range of issues related to health at organizations including the World Health Organization, the Center for Reproductive Health Research and Innovation, as well as his role over the last few years at the Lagos state government. And at LASEPA, he's leading the charge for a cleaner, healthier, and pollution-free Lagos. So Dr. Ajayi, welcome. Thank you for joining us.
Thank you. Glad to be here.
Wonderful. So, Evelyne, I will start with you. We know that air pollution is a problem on the African continent. We hear these statistics about really high exposures, about more than 1 million deaths occurring on the continent. But what is it that makes the story of air pollution unique? What is different about the continent? What are some things that set it apart from the same problem elsewhere?
Okay, thank you very much. Thank you for giving me the opportunity to be here. I can say that the air pollution is one of the major challenges that the continent is facing currently. And from the report, the various reports, is estimated that 923 million people in the sub-Saharan African only are affected by the air pollution. And in this air pollution, which come from different sources, the transportation, the cooking, and over the industries, we have overall about is estimated to 1.1 million of people who die of premature death in Africa due to the air pollution, and this represents about 16% globally. But in what makes the African country being so special is that we have sources such as Sahara desert in the northern Africa, but also the Kalahari desert in the southern Africa, which are source of a lot of pollutants. But we have also, with the way we are industrializing the modern life that we have also producing new sources that are also affecting the air pollution around us. And one of the cooking, for example, which is I can say the basic need of all human beings, because we need to feed every day. We don't have access to clean cooking system, so people are still using solid fuel, and all these solid fuel affect also the environment, which environment and also the health, but it also affects the kids that we have at home, because in Africa, most of the people in the kitchen are the women who are cooking with the young children when they do not start yet school. So they are with the mother, they are also affected. But we also have the transportation, which is one of the major sources in Africa, in the sub-Saharan. I will focus on sub-Saharan Africa because I think this is one of the major points. And the transportation system also is one of the, we don't have reliable overall, maybe a part of South Africa, which is a bit different. In most of the countries, we don't have a reliable, good transportation system, which make also the poverty that is making people go to buy the second-hand car, which are outdated in terms of emissions. So all these are really impacting the way our lifestyle and the urbanization, which is not always well planned. All this system is impacting the air pollution and also the human health and also the ecosystem, because the ecosystem are also impacted by the air pollution. So to not be too long, I think I can stop here, then we can have interaction if this is.
Yeah, thank you so much. I think you're, raising a lot of interesting points. And Dr. Ajayi, when I think about, some of the issues Dr. Touré mentioned, thinking about Nigeria, one of the most populated countries, really large. Lagos within that is, one of the Lagos city itself, a big, vibrant city undergoing urbanization, large population. And as the person leading the charge at La Cepa, you've been showing very strong leadership on air quality action. So I think I want to ask you a two-part question. One is, how did you decide the focus should be on air quality action? Because this is something we do struggle with in a lot of places, making air pollution an important enough issue. And then also, if you could tell us a little bit about some of your initiatives. I think we have some graphics here as well to showcase how La Cepa has been communicating, but would love to hear from you about what motivated this action and what are the types of interventions or actions you're taking at Lagos. I think you are on mute. So if I could ask you to unmute yourself.
Okay, I apologize for that. So for me, on this side of town, Lagos is Africa's largest mega city with a population of over 20 million. A population explosion ordinarily will come with pollution. So you expect that everybody or every human being generates waste. Along the lines of all of the air pollutants streams that Evelyne initially highlighted, from cooking emissions to vehicular emissions to industrial emissions, in Lagos we see huge quantums of all of these things. And my background as a medical doctor, as a public health professional, makes me more sensitive to those things. The second reason is that when you're measuring impact of any activity you're doing, for me, it's easier to draw a correlation between air quality and health. Again, because of my background and because of the exactness results, because of the results that you see, the visible results you see. For instance, studies from 2020, 2019 shows that about 23,000 premature deaths happen in children under 5, and that is from air pollution. So a lot of the children who are exposed to poor air or bad air will fall sick and die. So I thought it was important to pay a lot of attention to it. And along those lines, I have, along with my team in La Cepa, we have been able to champion a lot of initiatives, from making sure that the sensitivity and the documentation of air quality is raised. We have gotten a lot of research activity and grants in this line. We're partnering with more people now to document air quality and, make it seen. On the other hand, we're also creating a lot of interventions, so to the places where we have poor air quality, the cooking emissions from the major cooking hubs, where you have women roasting fish across town. We're putting kilns in place so that you reduce the emissions, you make their socioeconomic life better. You're also helping the health of the women. So you can measure the impact of, combating air pollution by just doing one intervention, two interventions in specific pockets of places, right? So all of these things put together are the reasons we continue to do the work on air pollution in Lagos. And also because we see that there's a lot of interest in this area, we see that our work is strengthening the narratives, the air pollution narratives in Africa. That is evident by the fact that we hosted the Africa Clean Air Forum last year. And, we're going to be very present and, strongly participating in the one in Kenya next week. So for me, I'm very inspired by, seeing other people strengthen their work based off the interventions we've made. We're also very happy with the fact that people are receiving our communication, because you see data every day. Areas that are visibly poor, we can immediately champion initiatives that would reduce the pollution in those places. So I'd like to pause there so I don't take all of your time. There's still some more discussions to have. Thank you.
Yeah, thank you so much for highlighting those. And actually, if we can bring up the image that we showed earlier when Dr. Ajayi just started speaking, I just want to highlight that, communication and the fact that the Environment Agency is really leading from the front and communicating about air pollution and trying to talk about how you can reduce emissions. It's a really helpful thing. It also, as Dr. Ajayi, you mentioned, can promote action elsewhere. Other cities and communities might get inspired. And that also, brings me to another related question. Evelyne, over a period of maybe 2-3 years, there was a massive assessment that was done, the Integrated Africa Science Assessment, looking at sources of air pollution, what the health impacts are, what the impacts on air quality are, and what can be done in the future. So can you give us a little bit of an insight into what this assessment did, since you were very closely involved with it? And also, what did this assessment find in terms of action that could be taken across African countries?
Okay, thank you very much. And exactly 2 years, I think 2 years ago, if my memory is good, with lead of AUC, the UNEPROA, the CCAC, we have the assessment which involve a lot of more than 100 scientists on the continent and also some from somewhere else. And we have, during the assessment, it was like to look at all the current development of Africa. Where are we going? Where are the emissions in terms of air pollution, but also in terms of climate, because all are linked. And from this assessment, we work together and we try to put this document together as a guide, showing what was going on. We have 3 main scenarios. The first scenario was like the baseline scenario. So we keep everything as it is, and then we continue what we are doing without changing anything. Then we have a second scenario, which was based on the SLCP's reduction. So if you reduce the SLCPs, what will be the result? And there was a third scenario which include a vision of the AUC, which we call the Agenda 2063 scenario, which was the SLCP plus the vision that the African Union wants for the Africa. So from that, we have 37 measures, which are from 5 sectors: the industry, the residential sector, the transport, the waste sector, which energy also, so making the 5. And from this, one of the particularities, or one of the beauty of this assessment, the 37 measures coming across all these 5 sectors are measures that are already or partially implemented on the continent. So it's not like a result that is suggesting something that is abstract or we can't touch it. Is something that is already implemented by a small group or small community somewhere else. And it shows that with this 37 measured across the 5 sectors, we can significantly reduce the emissions, improve our health, have a good mitigation for the climate, while we are also improving our lives, let's say, our environment. So we have, and as I said it before, the beauty is having all these measures which are already existing by small group. So the one from this assessment, we do not stop on the assessment. We also have opportunity because the AUC endorsed it and it was something that is feasible. We moved to the African Clean Air Program, which was launched last year, in September last year. So that we give opportunity to implement this 37 measures in Africa, having the basement on the regional economy, economic region that we have. So based on them, to allow all the countries to be moving. We know that the countries are not at the same level, but helping with the support of the CCAC, the UNEPROA, moving everyone to have move forward to a better environment and having saved life. I can say, if I can stop here. I don't know if I am too long or too short. You just
No, this is great. I will ask you to go back to one thing though. You mentioned SLCPs, and I know some people who are listening in will know what they are, but can you break that down? What does SLCP stand for, and why are you worried about those? Why were you modeling those in particular?
Okay, with SLCP are the short-lived climate forces, I think. So that are, and those one usually they are, one of the most known is the methane. It has a very strong impact on the greenhouse gases effect, and it can be quickly reduced because if you are, instead of, I take an example, having organic waste, which we produce methane. If you are able to recycle this organic waste into to be able to reuse it for fertilizer or over, so we can reduce, and we have a quick impact on the climate. Like the answer is quick and is it will be stronger as if you are reducing the CO2, which is more a long one, and the SLCPs, the short-lived climate forces, I can some is a lot of results more shows that if we are working on them, you can get a attenuation, a significant attenuation for the at the global scale and also even at the local scale. So if it's
Great. Yeah, thank you for clarifying that. And I think we have an image of the 37 measures, if we can pull that up for a minute. Dr. Ajayi, I'm sure you come across these types of big assessments and reports all the time, new information that is being generated. As someone who has to make very practical decisions about interventions and regulations and getting the public to move, how do you see the role of these types of data and evidence in making policy decisions? We also got a question in from Mark Broomfield, who's interested in understanding about, where does the public stand on this issue? Is there a push for more action, or is it not considered, a really critical issue that needs intervention immediately? So if we could hear from you, Dr. Ajayi, a little bit about the role of data and evidence and information like these, and also the push and pull in a way between the public and the policy action.
Right. So first, I would say that data informs policy, and when you when you're in a public office or in government, your first evidence point is research data. And for us, we're keen on converting research data into policy. So one of the things that, like I said earlier, triggered, my keen interest in air quality is the data available. So when academia partners with government and government institutions, it makes it way easier. So what we have pushed continuously is strong partnerships with academia so that we're able to translate this data into policy and implementation through several interventions that you have seen so far. Now, the other thing is the fact that government is interested in things that change the lives of the citizens, right? So whatever it is that you bring forward, whatever it is that you want to talk about, so long as it has a positive impact, a measurable positive impact on the lives of citizens, then I think government is more than happy to take it forward. So speaking of how government prioritizes, if I have a use case or if I have evidence that investing in clean air and investing in air quality interventions will save government 30 times of that investment in healthcare, then I'm able to make a justification. There's clear data all over the internet from the US CPA and even from Africa that a $1 investment in environmental health, particularly in air quality, will save you $30 in healthcare spend. Now, putting this data out there and putting evidence like the prior examples I gave will show to you that you need to invest. So this is how we convince governments to invest. This is how we push our policies. This is how we justify our spend in environment. Clearly, because we can make a case, and the case is backed by data globally. So it is not just Lagos saying that you save $30 by investing $1 in environment. It is backed equally by data from Europe, data from America, data from Asia. So there's global evidence that investing in air quality ultimately has an impact. It has an impact on the environment, on healthcare, on the quality of life of the people, even on agriculture, on everything. So for us, it is just presenting that data, and I think government prioritizes, which is why we're where we are. Which is why we do the work we do, and we continue to champion it for the life of Lagosians.
Amazing. I really hope that more policymakers around the world at all levels really follow the ideas and the way that you're thinking about air quality action. And it's this interesting mix of the science policy that I think helps us move forward faster and more efficiently. And that brings me back a little bit to the Clean Air Forum, which is happening next week. We're expecting at this forum a mix of scientists, policymakers, community leaders, and researchers, etc. And Dr. Ajayi, I know you will be at the event. So I would love to hear from you what you hope to see or learn or do while you were in Nairobi at the meeting. And Evelyne, since unfortunately we will miss you in person at the forum, what would be your message to the people that are there? Anything from the research and the scientific side, things that people should know, or things to think about as we are all gathering in one place. So maybe Dr. Ajayi, I'll start with you and then come to you, Evelyne.
Okay, so for the Clean Air Forum next week, on the one hand, I expect thought leaders from across Africa in research, in industry, in air quality equipment manufacturing, in policy and government to all come together, and even in the non-governmental organizations, the environmental justice space. I expect everybody to be gathered. I expect that we'll be able to share data and ideas. I expect that we'll be able to cross-check policies, to see which strong policies we can implement or which strong learnings we can borrow from other cities that have things working for them. I expect that the hard lines of enforcement of air quality standards, we can copy from each other's notes. I also expect that we can glean on more partnerships, so partnerships from other institutions that pay a lot of attention, drawing correlations between air quality and environmental justice, for instance. we can have those partnerships to push these things forward. I would also be looking forward to manufacturers of equipment and data scientists who manipulate and create predictive models for air quality information to share their notes and sort of do knowledge transfers with those of us in Lagos. We are also happy to share knowledge and inspiration from what we do in Lagos with other people. So for me, there will be several lines of engagement over the 4-day event. I also see that we will strengthen the accord or the relationships amongst different cities, particularly along the lines of air quality. And then we can form strong institutions out of these discussions, institutions that will go on to do bigger things. The likes of, of course, while at it, would expect that people who pay more attention to these things will now become the voice of the matter, voices in government. They'll become seen as the voice for these issues. So for me, I look forward to it. I'm happy to engage and discuss. I'll be there live, and I hope to make the best use of the time.
Amazing. I think that's an ambitious, very inspiring charter. So hopefully we can meet that. Evelyne, what would be your message to the group that is gathering? What do we need to know? What do we need to think about while we are deliberating?
Okay, thank you very much. Unfortunately, I will not be there, but my heart will be there. So I want to say that as a scientist, we need to start building a solution, science-based solution for our population. Because the air pollution is real, it's not something that is far from us, it's not something that is virtual, it's real. We can improve our life, and we can give hope, we can improve our environment, improve the future for our kids by working all together, government, scientists, private sectors. So at the end, we have to communicate, we have to put things together to improve not only one human life, but all our population in African life. So the air pollution is real. Let's work together. Scientists, private sectors, government, everybody should play his own part. But together we can save life, we can make Africa develop on a better way and have a good health for our population, especially our kids.
This is great, Evelyne, because you're really sort of echoing what the theme of the forum is, which is partnership for clean air solutions. So I think you really hit the nail on the head. As we come to the close, one of the things that I personally find very fascinating and inspiring, and I'm sure others do as well, is how people, get to do the things they do professionally. And it, especially in this context where we know Africa is a young continent and air pollution is a problem that we need to be solving all together, it would be great to hear about your professional journeys. Was it a particular moment that led you to work on this issue? Was it something else? Like, how did you get started on this work on air quality, and what keeps you going? I think it would be fantastic to hear both of your stories. So Dr. Ajayi, perhaps I'll start with you and then go to Evelyne.
Oh yeah, so my journey into air quality monitoring and interest in clean air, I'll be honest, started with my sojourn in the Health Ministry of Lagos. So I used to work in the Health Ministry as the special advisor, assistant to the governor at the time. On that role, it was right in the middle of COVID. And I was saddled with the responsibility of leading the oxygen strategy for the state. During COVID, a lot of people were very ill, and we had to get oxygen for everybody, 26 million people. About a decent 10,000 people were critically ill, and they all depended on oxygen. Clearly, it said to me that oxygen is life, and clean air is important, because it was primarily a chest disease. So because I led the oxygen strategy, I led the setup of several oxygen plants, I knew the importance of clean air to life. I have also seen firsthand how, air pollution kill, young people, even adults, the vulnerable people in the society and things like that. So when I got into LASEPA, I felt it was one big charge to then, live and put policies together for this thing that I so much believe in. And on this journey, I have met with people. In fact, I'm in partnership with different institutions for research along the lines of clean air. We've gotten grants, we've gotten different kinds of support, air quality monitoring equipment. In fact, we have gotten people to developers locally to now begin to manufacture air quality equipment. So we think that, so that journey for me has been very fruitful. I think that the impact on life, it goes beyond just words. I think that it transcends just letters. It goes on to the actual direct benefit that people get from the kinds of interventions that we make across those lines and the policies we put in place. So basically, I think that's a summary of my journey, and I think it's been very rewarding.
Great. Thank you so much for sharing that, Evelyne.
Okay, thank you. I think my journey is, I can say I like the environment. I like doing something that impacts people's life. So I was also inspired by wonderful women who is in the field. I will not cite anyone name, but I think if they are watching, they will know themselves. And they are the inspiration that I have that is making me work every day and say that what I'm doing is to impact future generation. What I'm doing is to improve people's life. And having a better life is having hope, is having a lot of, let's say, vision of what you can do. So that is what is keeping me moving forward and also trying to have an impactful life, not just for me or my family or my society, but I want to have it broadly for the continent, having something done that will improve the young kids we have one of the youngest continent where a lot of kids are coming. They have right to have to grow up in a clean environment where they can grow and enjoy life fully. Thank you.
Amazing. And I do hope there's people listening in who are also getting inspired by the work that both of you are doing. So as we get to a close, a lot of our conversations on air pollution, the calls to action, the need for more data, the need for better solutions, they tend to happen a lot in English. And I know between the two of you, you speak a variety of languages. So I'll let you both pick whichever language besides English that you like, but I'll give you each a minute to share a message in your language of choice about air pollution, either the need for action or the solutions that are available to us. And Evelyne, I will start with you. Your choice of language, 1 minute, and then I will come to you, Dr. Ajayi.
Okay, because a lot of people are francophone, I will choose to speak in French. Nous pouvons ensemble combattre la pollution de l'air, améliorer notre environnement et sauver des vies, surtout celles des plus jeunes de nos enfants. Merci.
Dr. Ajayi.
So I'll speak in Yoruba. Yoruba is one of Africa's widest spoken languages across the entire West Africa. Ẹ̀yin èèyàn mi, ẹ jẹ́ ká mú èémí tá à ń mí ká fi ṣe pàtó. Ẹ jẹ́ ká ṣiṣẹ́, ká gbáwọ́jọ pọ̀, ká fi gbé ètò wa lárugẹ. Ẹ jẹ́ ká bá àwọn ènìyàn wa sọ̀rọ̀. Ẹ ṣé gan. Thank you very much.
Thank you so much, both. Thank you very much for taking the time to be with us today. And I think what I'm taking away from this conversation is both a message of inspiration. There's a lot that's already happening. There's a lot that can be scaled up. And also to see both of you talk about the need to work across sectors, across science and policy, with the private sector, with all other types of entities out there that can help us make a difference. I think that's critical. Dr. Ajayi, looking forward to seeing you in person next week. And Evelyne, hopefully we'll see each other in person sometime soon. Thank you both for the wonderful work that you are already doing to make the air better for all of us to breathe. We really appreciate all of your work and leadership. And Folks, thank you so much for listening in. We hope that you enjoyed this conversation. We will be back on August 7th to talk about wildfires and air quality. In the meantime, check out the previous episodes, and hopefully, we will see some of you in Nairobi next week. Once again, thank you so much, Dr. Touré, Dr. Ajayi. We thank you for your time, and see you next time.